Hello, everybody, and welcome. This is Nurse Eunice with Florida Training Academy. And in today's video, we have 25 multiple choice exam questions to help you pass your CNA test. We'll get started in 10 seconds. Good evening, everybody. Hello, I see Esther and Shelda. Good evening. I hope you're having a great day. Shelda, don't be afraid to take your test. You are studying, get paper and pen, and let's go, girl. You got this. All right, everybody, let's get started. Question number 1. Which chronic illness often requires dietary restrictions related to fluid intake? Is it A, chronic obstructive pulmonary disease or COPD? B, Alzheimer's disease, C, rheumatoid arthritis, or D, congestive heart failure? Which chronic illness often requires dietary restrictions related to fluid intake? Revealing the answer in 3, 2, and if you chose D, you have the correct response. It is congestive heart failure, or CHF. CHF often leads to fluid accumulation, so clients with CHF typically require restrictions on fluid intake to prevent fluid overload. And so early stage, they may have some moist lung sounds. We call those crackles. They may be audible without a stethoscope. Late stage is when those legs and those feet start to swell. So that whenever you see that type of patient, usually they're going to be on a fluid restriction. In addition to that, the doctors will prescribe a diuretic, something that's going to help them urinate, pull out that extra fluid. All right, let's go to question number 2, everybody. If you haven't done so, please start putting your answers in the comment or chat area so that this can be more interactive. Question number 2. When caring for a resident with a catheter, what is essential for preventing urinary tract infections? Is it A, empty the drainage bag once a day? B, change the drainage bag weekly? C, use water to clean a catheter? Or D, keep the drainage bag below the level of the bladder? And I'm going to refer to my phone because I'm not seeing any comments coming through, and that is unusual for our YouTube channel. So just give me one moment to go to my phone to see if you all are putting comments in that I cannot see. All right, revealing the correct response in 3, 2, and if you chose D, you are right. We're going to keep the drainage bag below the level of the bladder. Keeping the drainage bag below the level of the bladder helps to prevent the backflow of urine and reduces the risk of infection. All right, now I can see your answers. I can see your answers on my phone, but I cannot see the answers via the software that I'm using to stream. So if you see me looking to the side, it's that I'm looking at your answers there. So hello, Egbo, Agnes, Lordia, Victoria, Zabine, Innocent, Venus. Hello, everybody. All right, so question number 3. A resident with dementia refuses to take a bath, saying, I already bathed today. How should you respond? Is it A, insist that the resident bathe now? B, skip the bath and document their refusal? C, calmly explain that it is time for their bath and offer reassurance? Or D, ask another CNA to help convince the resident to bathe? What do you think the best response is, team? Hold up, looks like Beaky has some great information here, everybody. So Beaky, congratulations. You are so welcome. I'm so happy you passed the knowledge portion of your exam. Future nurse in the making. You got your results back yesterday and you passed with flying colors. That is right. So I am so proud of you. Everybody give Beaky a warm applause. Congratulations. And we wish you much success on your journey. All right, everybody. Question number 3. A patient with dementia, they refused a bath. The correct response is going to be C. Yes, great job. I see we're torn between B's and C's. And so residents with dementia may resist care due to confusion or fear. And so you can offer reassurance and a calm explanation. And now, if they still refuse, that is when you would report it to the nurse. But you just don't want to report it to the nurse right away or document a refusal because they are confused. Sometimes they're going to forget that they ate. Sometimes they're going to forget. They may think that they took a bath today, but it could have been 2 days ago. And remember, you're not always I'm giving them a bath because they smell, because they have body odor. You're giving them a bath so you can actually assess their skin and remove those germs off of their body. So that is the reason why you want to reassure them and offer, a bath again, just to be sure. Question number 4. A resident with a tracheostomy tube has thick mucus blocking the airway. What should you do? A, remove the inner cannula. B, tell the resident to cough forcefully. C, change the tracheostomy dressing. Or D, notify the nurse and stay with the resident. So the tracheostomy, that's the opening in the trachea. That's their artificial airway. And they have thick mucus blocking their airway. What should you do as the CNA at the bedside? And everybody has it right. It is, drum roll please, it is D. CNAs are not authorized to remove the inner cannula, so you're not doing any of that. You're staying with that resident and you are calling the nurse immediately. She will know how to clear the airway, suction it, and if she can't clear it that way, she can remove the inner cannula and place a clean one in. So sometimes they do get clogged with that dry mucus really thick. You tell them to cough forcefully, can nicely further block their opening. So coughing right now isn't helping. That nurse needs to come in and suction. Question number 5. While assisting a resident with dressing, you notice redness and a small blister on their heel. The nurse is currently occupied with a patient during a procedure. What should you do? A, notify the nurse immediately, even during a procedure. B, apply a bandage to the area. C, document the observation and proceed with dressing. D, elevate the heel and notify the nurse as soon as she is available. Oh, make sure when you're taking your CNA test, you all, that you read all of the questions, that you just don't assume. Don't just rush and give me an answer. So I see so many A's coming through. This is not an emergency. Your nurse is currently dealing with somebody in a procedure. That is the priority. So what is the next best answer if it's not A? That's right, Natisha. That's right, Sherlyn. It is going to be D. All right, you all, give the nurse breathing room. You're going to elevate the heel and notify the nurse as soon as she's available. Do not bust in that room and, interrupt her and the doctor while they're in there doing a procedure. So redness and blisters are an early sign of a pressure injury. While it's important to notify the nurse, it's equally crucial to avoid interrupting the nurse during a procedure unless it's an emergency. Elevating the heel helps to reduce the pressure on the area while awaiting the nurse's availability. So the response to this one is D. All right, question number 6. When assisting a resident with dressing, what should the CNA do first? A, ask the patient to choose their clothes. B, put on the patient's socks. C, assist the patient with putting on their pants. Or D, button the patient's shirt. All right, what do you think the correct response is for C? And because I think there was a delay in the comments, I guess something's going on with the system. I want you to put the question and then the appropriate answer, whatever you think the correct response is. So for 6, everybody, I see a whole bunch of A's coming through. Great job. Remember that on your test. Even if for the prometric exam, you're going to be dressing a mannequin. After you introduce yourself, wash your hands, gather your supplies, you have to ask that mannequin, what would you like to wear today? And you're going to have a choice of items. So allowing the patient to choose their clothes promotes autonomy and respect for their preferences. If you got that right, give yourself applause. All right, let's go to our next one, everybody. Question number 7. A resident has difficulty swallowing and begins coughing while drinking water. What is your priority? A, encourage them to eat some bread. B, hit them in the middle of the back repeatedly. C, stop offering water and notify the nurse. D, offer solid food instead. And Charlene, I am so proud of you, girlfriend. Wonderful job. Congratulations, Charlene. So that's 2, in addition to all the emails and texts that I received from you all. I am so proud of you, my baby nurses, my future nurses. Great job on passing your CNA examination. But back to question number 7. They were drinking water. They started coughing. What do you do? Oh, we got C's, we have B's, but we have way more C's than B's. So it is C. You're going to stop offering the water and notify the nurse. So difficulty swallowing and coughing while drinking water could indicate dysphagia or an aspiration risk, which can lead to choking or pneumonia if not addressed immediately. So the priority is to stop offering the water, y'all. Oh, let's not drink anymore. Let's try to cough until this nurse gets here. In this case, you do want her to cough. Offering food or other liquids without a proper evaluation could worsen the issue, and hitting the patient in the back is old wives' tale. Whenever you hit a patient in the back, whenever they are coughing, you're like, oh, they're choking. Let me hit them in the back. The reason why they stop coughing is because you made the object go further down. You want them to cough so the object can go up, and even if it doesn't come out their mouth, if it comes up enough, when they swallow it back down, it's going to go into the right airway. It's going to go into the right spot. So it'll go down into the stomach. So don't hit them in the back, because it's going to force the object to go into the lungs, and that's how they get aspiration pneumonia. All right, question number 8. A resident with a history of wandering is not in their room or common areas. What should you do first? A, search nearby areas systematically. B, ask another CNA if they have seen the resident. B, ask another CNA if they have seen the resident. C, ask other staff members to check the building exits. D, notify the nurse immediately. All right, what is the correct response, you all? And if you have watched more than 2 of my videos and you are not subscribed, help a nurse out. Go ahead and subscribe, make it official. And if you could give this video a thumbs up, I'll appreciate it. The goal is before the summer. I would love to have 1 million subscribers. We're at 830 subscribers. And so by summer, we're going to have 1 million subscribers. And I will be the only nurse that I know who has a gold play button. So help me make history. All right, everybody. Question number 8. The answer is, that is right, Shakira and Chris Love. It is D. Y'all want to notify the nurse. The nurse can put the rest of the actions in motion. Maybe the nurse knows that the person went down for an x-ray. The CNA may not know that, the other CNA who has the other 15 patients. So notifying the nurse initiates the facility protocol for locating a wandering resident and ensures a coordinated response. So if you don't notify the nurse, she won't be able to notify security, to notify the family. So we need to put some steps in action in order to make sure this person's safe, even going to calling the police so that they can do a search for the patient around the building. All right, so because we can't always leave because we have to take care of the people inside of the building. Question number 9. What is the correct way to perform nail care for a diabetic patient? A, file the nail edges with a nail file. B, soak the feet in hot water before trimming. C, use fingernail clippers to cut the nails. D, trim the nails very short. What do you think, team? Hey, Sungyu, Pierre, Linty, Vina, Stephanie, Innocent. I think Innocent or Blessing, I owe you videos on infant care. I haven't forgotten. Just this whole week has felt like a Monday, so just bear with me. Hi, Mila, Danita. Let's see. Revealing the correct response in 3, 2, and that is right. It is fouling the nails. That's all you can do. You all above your pay grade. They need stuff clipped. That is not your responsibility. So fouling the nails helps to prevent jagged nails and injuries. If the nails are jagged and they scratch themselves, they can actually cut their skin. That can cause an area that can become infected. So whenever you have a diabetic patient, remember, if they have an injury, it's hard for them to heal. So we want their nails fouled but not jagged. And you also cannot clip anything, whether it's a diabetic patient or not. This patient could be on blood thinners, and if you decide to clip and you nick their skin, well, now you've caused a bleeding injury that can also become infected. So CNAs do not do not clip anything. Mila's crazy. She's excited for snow. I am not. True Floridian here. All right, so question number 10. A resident with a feeding tube appears restless, complains of nausea, and has an elevated respiratory rate. What could these symptoms indicate? A, the resident is experiencing anxiety. B, the feeding tube may be causing complications. C, the resident is dehydrated and needs water. D, the resident is adjusting to the feeding routine. Why is this important? Because you all spend more time with the patients than the nurses. And so if your patient has a feeding tube, is restless, their stomach hurts, and they're breathing faster, you need to start thinking like, what's going on? Is this something that can wait? Should I be telling the nurse now or should I tell her later? And so for this one, if you choose B, you're absolutely correct. Great job, team. So nausea, restlessness, and an elevated respiratory rate are signs of potential distress and could indicate complications with the feeding tube, such as improper placement. Yes, the feeding tube can come out too. Intolerance to the feeding, maybe we're feeding them too much too fast, or gastrointestinal issues. Maybe they're not digesting the food properly. So prompt recognition and reporting to the nurse are crucial, and a good CNA will be doing all of that. So great job, my future CNAs. Question number 11. A resident is complaining of pain and swelling in her calf, and the leg feels warm to touch. What might this indicate? Is it muscle? Is it A, a muscle cramp? B, they need to eat a banana? C, peripheral neuropathy? Or D, deep vein thrombosis? What do you think, team? Because we have great caregivers at Florida Training Academy and Nurse Eunice's online CNA exam prep course via YouTube. So, Gertie, Star, Mrs. Love, Child of God, Thayla, Christ Love, Venus says, I don't know. Rose, Isatu, you all, pain, swelling, and it feels warm in the calf? Oh, more than likely they have a clot. It is a deep vein thrombosis. So you're going to keep that person as still as possible and get that nurse in the room, because pain, swelling, and warmth are all signs of a potential blood clot. This is a medical emergency that should be reported immediately. Remember, you're not going to get them up and walk them right now, because right now it's just a clot that's in the leg. But if you get them up and move them about, that clot could travel. And if it goes to the brain, they're going to have a stroke. If it goes to the heart, they could have a heart attack. If it goes to their lung, that's a pulmonary embolism, and they could stop breathing. So keep them in the bed, get the nurse in the room. All right, so our next one, team, question number 12. A resident complains of frequent urination, excessive thirst, and unexplained weight loss. Which body system might be affected? Is it the respiratory, digestive, endocrine, or nervous system? Frequent urination, excessive thirst, and unexplained weight loss. These are classic signs of a disorder. Oops, left my phone on. What system would be impacted? All right, so it looks like we have Rahel, Alicia. Rahel says C. Carolyn says D. Zebony says C. Fela. We're torn between C's and D's. So you all put in the chat, what disease or disorder do you think this patient has? What would cause frequent urination, excessive thirst, and unexplained weight loss? What disease is it? I know you're not nurses and I know you don't diagnose, but this is classic. All right, revealing the answer in 3, 2, and it is the endocrine system. Fela says, see, it's the endocrine system, but why? It's not a UTI. Rahel has it. This person has diabetes, but normally when we think about diabetes, we only talk about hypoglycemia when the blood sugar is low. These are classic symptoms for when the blood sugar is high, when a person has diabetic ketoacidosis. So the endocrine system, the pancreas, those hormones, insulin, that is all part of the endocrine system. So these are symptoms of uncontrolled diabetes. Notify the nurse for proper evaluation. Don't forget, when their sugars are really high, they're going to have that fruity odor from their breath also. All right, question number 13. Which of the following terms means abnormal enlargement of the liver? Is it hepatitis, megaliver, hepatomegaly, or gastritis? Let's see. What do you have, team, for question 13? All right, revealing the answer in 5, 4, 3, 2. I can't believe that. Yes, Carolyn, I made up a word. So everybody chose C. There is no such thing as megaliver or whatever it is. So the correct term is hepatomegaly. So hepatomegaly refers to the abnormal enlargement of the liver. Question 14. A resident is experiencing muscle weakness, confusion, and an irregular heartbeat. What might this indicate? Is it, and I'll take one of two answers for this one. Is it dehydration, an electrolyte imbalance, an anxiety attack, or low blood pressure? Muscle weakness, confusion, and an irregular heartbeat. So when you palpate the pulse, it's not rhythmic. It's doom, 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 doom. It's doing all types of things. It's like, whoa, that feels irregular. Danita says she's going to take notes. All right, so revealing the answer in 3, 2, and I'm not sure if I saw a right answer yet for 14. I think Star has it. So yes, please take notes. So everybody, 14 looks like we have Star, we have Thela, we have Gertie, and Diormorcia. Diormorcia. Yes, it is B, electrolyte imbalance. They are missing something, whether it's potassium. So when I say, hey, eat a banana, yeah, sometimes their electrolytes are out of whack. So muscle weakness, confusion, and irregular heartbeat are signs of an electrolyte imbalance, such as low potassium. There's no way possible they can eat enough bananas while they're in your care. The nurse is going to call the doctor. We're going to get labs ordered, and they can either start taking potassium supplements, potassium pills, or if it's really low, the nurse will hang a potassium drip. We can start adding potassium to their IV fluids, because if the potassium level gets too low, their heart stops. So really important, if you notice those telltale signs, muscle weakness, confused, and the heartbeat's irregular, let me get the nurse in the room. So Hamdi, I hope I just explained the electrolyte imbalance. It is maybe their sodium level is too low, maybe their potassium level is too low or too high. So their electrolytes, their magnesium is not within the normal range. Whenever the electrolytes get out of balance, it's usually going to impact the internal organs such as the heart. All right, everybody, question 15. A resident has a flushed face, rapid breathing, and complains of a pounding headache after eating salty food. They had a crab boil. Which body system is likely affected? Is it the digestive system, the immune system, the cardiovascular system, or the respiratory system? Yep. Cousin Joe got to stop eating all them seafood and crab boils, all that salt and sodium. So what do you think the correct response is? And everybody has it. It is the cardiovascular system. These symptoms may indicate high blood pressure, especially following a high sodium intake. Remember, they've eaten all this salt And now the fluid's going to follow. It's going to make their blood pressure go up, and now their head hurts, etc. So you have to report that to the nurse right away. You report the symptoms, and the nurse will tell you that, hey, get a set of vital signs. And the vital signs will help confirm what we thought. They just did too much that day. All right, so question number 16. A CNA records a resident's blood pressure as 160/90, but does not report it to the nurse. What type of medical error does this represent? Is it a communication error, a documentation error, negligence, or equipment malfunction? Let's see. 160/90. You didn't tell the nurse. What type of error would that be? I see C's, I see B's. I know that you all think it's negligence, but right now, because it's between you and the nurse and not you and the ethics committee, not you and the patient had an untoward, something worse happened. So it's not necessarily negligence yet. All right, so yes, it would be a communication error. It is, hey, look, you all, I'm busy, you're busy. If something is wrong with that patient, you come find me and let me know. Just don't document it in the computer, because with my busy self, I may not check the computer for 2 hours. So you are going to notify the nurse. You're going to communicate, because failing to report abnormal blood pressure readings is a communication error. You're going to impact the patient's care. So timely reporting is critical to prevent potential complications such as a stroke or heart attack. Question 17. A CNA notes a resident's temperature is 101.5 degrees Fahrenheit and delays notifying the nurse for 3 hours. What is the risk of this error? A, the patient may feel uncomfortable. B, it could lead to dehydration. C, the resident's condition could worsen, leading to sepsis. D, it may cause a medication dosage error. Everything you do as a CNA is so important. We do hands-on classes in Jacksonville where we're teaching you all these skills. And they're like, I got to learn 21 skills, but I'm only tested on 3. Yes, because when you enter a patient's room, you know all these skills, but you don't have to do all the skills on every patient. You may only have to get them up to the bathroom. You have to know how to wash your hands and put on gloves. So you literally need to know 3 skills in order to help a person to the bathroom. And then, of course, let the side rails up, give them the call bell, etc. So if you take this person's temperature and you don't notify the nurse for 3 hours, this patient could become super sick because they could be septic. The answer is C. A temperature of 101.5 is a sign of potential infection, so delayed reporting may allow the condition to progress, increasing the risk of severe complications like sepsis, and you're delaying treatment. So what happens whenever you come and you tell us that a person has an elevated fever and this is a new finding? I'm going to go back and recheck, then I'm going to call the doctor. Once I call the doctor, hey doc, this patient in room such and such, this is the full set of vital signs. I'm just not giving a temperature, but I'm going to lead with the temperature if that's the only one that's abnormal. What orders do you have? We're going to get sputum specimens, urine specimens, stool specimens. I listen to the lungs. If the lungs have any type of abnormalities, we're going to get chest x-rays, whatever their original issue was when they came into the facility. Maybe we need to rescan that. So when someone has a fever in your facility, we take it seriously, because if it goes untreated, they're going to get worse. All right, so question 18. A resident has a heart rate of 45 beats per minute and feels dizzy. What does this most likely indicate? A, normal variation for the resident. B, mild dehydration. C, anxiety attack. D, bradycardia requiring urgent attention. We're torn between D's, and I see one B so far. I see another B. You all, mild dehydration is not going to cause the heart rate to decrease. Dehydration causes the heart rate to elevate. This heart rate is 45. Remember, the normal for an adult is 60 up to 100 beats per minute. So this is not dehydration. This person has bradycardia. So if you chose D, great job. Give yourself applause. Do my crazy nurse dance. A heart rate of 45 beats per minute is abnormally low and can lead to inadequate circulation. If you stand this patient up, they're going to faint on you. Keep them in the bed. This must be reported to the nurse immediately for evaluation. Question 19. If a patient is described as ambulatory, what can be inferred about their condition? A, they require a wheelchair. B, they are bedridden. C, they can walk and move around. D, they need assistance with standing. And if me reading these questions to you and reading the rationales is helping you, we have a whole playlist. I'm sure I've covered any test that the board can throw at you at this point for the CNA examination. Remember, when you are reviewing our playlist with our practice questions, you're not trying to learn the question. You're listening for the keyword, you're learning the keyword, and you're learning the response. If this happens, this should be the appropriate step. What is important? Prioritizing. And also, if me reading is helping you, don't forget that when you take your CNA examination, you can ask for an audio test. That means that the computer will read the questions to you and also read the answer responses. And so, everybody, if you chose C, you got it. And then, Kelly, the written test isn't hard. It's all a mindset because you're practicing and you're studying. So you're going to do well with your written test also. So an ambulatory patient can walk and move around with or without assistance. Please check the patient's plan of care, their orders, to view their activity orders. Because remember, especially if someone had a stroke, sometimes they overestimate their abilities and they remember what they could do yesterday before their stroke. And they're like, oh, no, I don't need any help. I can walk. No, sir, you now have weakness on one side. I'm going to be here to assist you as we walk to the bathroom. Yes, Venus, I hope that helped you. Question 20. Which food item should a CNA encourage for a patient with anemia? So they have a low hemoglobin level. Those hands are going to be cold. They may have a cold intolerance. They're like cold all the time. So A, is it white rice, pasta, and applesauce? Is it B, spinach, red meat, and fortified cereals? Is it C, orange juice, bananas, and yogurt? Or is it D, potatoes, white bread, and chicken broth? What do we give somebody to get their iron levels up? And Jeanette says B. So everybody revealing the answer in 3, 2, and yes, it is B. So these foods are rich in iron and essential nutrients to combat anemia. Spinach and fortified cereals provide non-heme iron, while red meat is an excellent source of heme iron, meaning blood, which is more easily absorbed by the body. Pairing iron-rich foods with vitamin C, such as orange juice, can further enhance absorption. Yes, Carolyn, bananas get the potassium up. All right, question 21. You are feeding a patient with dysphagia. Which item should not be given to this patient? Is it food thickener, thick liquids, thin liquids, or mashed potatoes? Which should not be given to a patient who has a swallowing concern? They're having difficulty swallowing. Yep. Hamdi, give me another answer, Hamdi. Songyu, give me another answer. Danita, give me another answer. So for 21, it is not B. They can have thickened liquids. They can't have thin liquids. The answer is C. So thin liquids, they can just slide right down into the trachea and go into the lungs. So they need thickened liquids. Thin liquids can be difficult for patients with dysphagia to swallow, increasing the risk of aspiration. Question 22, true or false? CNAs are allowed to independently decide to use physical restraints on a resident if they believe it is necessary to ensure the resident's safety. So today you're working in mental health, you're on the behavioral health floor, and this patient is throwing things. They're trying to hit you. Is it okay for you as a CNA to restrain that patient? What do you think, team? Great job. False. You cannot restrain them without a doctor's order. So the use of physical restraints must be authorized by a physician or under specific facility protocols. CNAs are not permitted to make this decision independently, as misuse of restraints can violate patients' rights and lead to legal issues. Yes, Shakira, you have to notify the nurse who will notify the doctor to get the order to restrain the person. Question 23. What is the role of teamwork in dealing with difficult patients in a healthcare setting? A, minimize collaboration to avoid conflicts. B, work independently to assert individual authority. C, collaborate with colleagues to develop effective strategies. Or D, compete with colleagues to gain recognition. Look, we know Sally's annoying to work with. Sally's been there for 30 years and she doesn't like new CNAs. And so you try to avoid Sally and Sally tries to avoid you. But that negatively impacts patient care. And so I need for you and Sally to find common ground. So everybody who chose C, you have it. So we're going to collaborate with colleagues because it helps to develop effective strategies and provide comprehensive care to difficult patients. So we have to work together, you all. Question 24. What is a critical consideration when assisting a patient with eating? Is it encouraging the patient to feed themselves? B, check for dietary restrictions and allergies. C, feed the patient as fast as possible because you got 15 patients and you need a break too, and you want to go home and you want to be on your phone and talk to your boo. Or is it D, only provide liquids? So what is a critical consideration? What is important? Which of these is a priority? And that's right, Rebecca and Chris Love and 242 Mama and Al Jara. No, that was Al Haji. Yes, you all have it correct. It is B. We want to check for the dietary restrictions. Maybe they can't have too many fluids. Maybe they can't have too much salt and the allergies, because it helps to prevent adverse reactions and ensures the patient's safety. Question 25. And if you've been with me for this long, you got to help a nurse out. I need for you to hit the like button. I need for you to subscribe. And then tomorrow I'm coming on, but it's going to be a nursing video tomorrow. So I know sometimes I confuse you all, but remember, as a nurse, I have a master's degree in nursing education. And I'm also a training center faculty member for the American Heart Association. So I just don't train CNAs. I train nurses, doctors. I train like the whole gamut. So if I'm ever on here and I'm talking about something that doesn't relate to CNAs, just do know that your video is coming. But tomorrow it's going to be a video for my nursing students. All right, so question 25, true or false? CNAs can use their personal smartphones to look up medical terminology during their shift to better understand a patient's condition. Oh, I've never heard about that condition before. Let me look it up. Oh, let me click on the picture. Oh, is that something you can do? True or false? And everybody said false. Great job, team. I'm so proud of you. So using personal devices during a shift can violate facility policies, compromise professionalism, and risk exposing protected health information. CNA should never use unapproved devices. Your hospitals have computers. They have, they call it the intranet. So not the internet, it's their in-house intranet that has a medical library. It has patient information. So if you can't find what you need there, go talk to your nurse and ask your nurse what's going on so that your nurse can help explain it to you. And guess what, team? Great job. I am so proud of you. Give yourself applause. And so remember, I'll be back on tomorrow, but tomorrow will be a video for my nursing students, and it'll be about the same time. So if I don't see my CNA babies until next week, know that I love you and that I am so proud of you and that you are the future of healthcare and what you do matters. So I'll see you all in the next video. Bye, everybody.